Hi everyone, it's Cindy. Coming to you with my VSG vertical sleeve gastrectomy surgery on March 24th with Dr. Gluck with Life Without Limits in Muskegon, Michigan. My highest weight was 318 pounds. My pre-op liquid diet, I was down to 310. Pre-op weight was 297. Post-op day 4 was 293. And post-op week 1 was 289. That's 29 pounds lost since my highest weight and 8 pounds lost since the surgery 8 days ago. One thing that I have to impress upon everyone to keep in mind, I am not sure how I missed it. Lots of paperwork, lots of things to go through, lots of classes to go to, but for some reason it was not written down in our things to follow on the way to surgery. I ate a can of cream soup the day before surgery, and that almost cost me not getting the surgery. Luckily, I had the bowel prep that night and had lots of time before the surgery that the doctor was convinced that everything was out of my system and there wouldn't be a danger in going through with the surgery. But I would suggest clear liquids only. Don't do any kind of foods, soups, or anything if you can try not to. Just to make sure that your bowel and everything, if they happen to nick something, you're in the best case scenario to keep from getting any kind of infections in your stomach. Fortunately, I was still able to have my surgery. I, for one, am not somebody that's very good with the gas itself. I've had many surgeries in the past, so I thought this time around, I'll probably be alright, Not usually too bad. I usually come home the same day. Not in this case, though. I was under for an hour, and it took an hour to do the surgery. But I was asleep for about 3 hours after the surgery, and I did wake up in a lot of pain. They had to give me more pain control than what they had started with. I'm on a high-dose morphine painkiller in the first place with my back. So it takes quite a bit of painkillers to keep the pain down for me. I did have quite a bit of nausea. The ice chips did help. They gave us those as soon as we got to our room. They encouraged walking right away, like within an hour or two of getting to our room. Ice chips, no consumption of water at all. You get a lot of IV fluids, so your fluids are kept up. You're able to go to the bathroom. You do have a tube hanging out of your stomach that drains off fluids, keeps you from getting infections and letting that stomach release some of the fluids without being internal. So there's a little drain tube that you go home with that comes out of your stomach and goes into a little round ball that you're able to empty and things like that. But maybe some surgeons might not have it. My surgeon did. So that was hospital day 1. Hospital day 2, nausea still stayed the same. I woke up with nausea. They wanted me to do a barium swallow to do the swallow test and take pictures. I was able to get there, do the swallow, get the pictures done, and that's all she wrote. As soon as I got them pictures done, it was all coming back up. I just could not keep it down. My nausea was so bad. So that caused me to stay an extra day. Then it also pushed out what I was supposed to start drinking and so on. But they got me drinking a ½ ounce of water every 15 minutes. And then doing the walking. I was able to get up then after the nausea settled down and get some laps in around the nurse's station and so on. I still really wasn't feeling up to 100% yet, that's for sure. Day 3, when I woke up, I was feeling a lot better. I was able to get my ½ ounce of water in, no problem, every 15 minutes. And they have you document what you're doing. Keeps you busy. And then they let me leave at noon that day. I slept quite a bit coming home. Once I got home, I found out that I could not lay in my bed. It was just too painful. I already have a bad back, and I couldn't even get laid down. So, ended up making a place on the couch, and I slept sitting up with my legs on a footstool for probably about 4 days, just to keep myself comfortable. It wasn't the best to sleep, but I'll take it, you know. I sure as heck couldn't sleep laying down. You have that void from your stomach, and moving around, it just doesn't like laying on its side. But that does improve. Like they say, every day gets better. And yeah, at first it's like, oh, what did I do? And I'm like, it's gonna work. It's got to get better. There's, can't get any worse than this, that's for sure. So anyway, they let me go home with that ½ ounce every 15 minutes. And they want you to increase that to 1 ounce every 15 minutes over the next, that week, during that week, till you get to your doctor. But they want you documenting everything you put in and everything that's coming out, even draining your drain. I had home nurses that came to the house. Now with Medicare, that's a free thing. There's no copays or anything with Medicare with that. I highly recommend you take it, because they're well worth it. They're there checking you out and double checking things, looking at your incisions. They took pictures of mine. There was some concerns when I left the hospital because I had a rash, and we wanted to keep an eye on that, and it was just getting worse. So at least they were able to document what was going on. I had a binder on that holds your stomach in real tight, and that felt great. But I think that was causing some of the rash problems too, like a heat rash. We're still not completely sure what exactly it was. But anyway, take the nurse visits. It's great for them to come out. They come right out to your house. And they also took the drain right out of my stomach on Saturday. And that was, 5 days after surgery, from Monday to Saturday. They took that drain out, and we cover it up, and we were able to shower everything. With everything just kind of open. You got your steri strips on there, and cover up the main hole from the drain, and then rebandage it after your shower. Let's see. So my homework was to document everything coming in, going out, and then go to my follow-up on yesterday, which my follow-up went very well with Dr. Gluck. He noted that my stomach did have a little bit of gastritis in it. They do testing afterwards on your stomach to make sure you didn't have any kind of cancers or anything like that. And they test it all up and let you know. So, from what I understand, everything went perfect. And the only thing I'm kind of dealing with is this rash. And he took a look at it yesterday, and he's kind of like, well, do you have any allergies? And I said, no, I don't have any allergies. He said, well, you have one now. The hard part is finding out what it is. We don't know if it's what they used to wash my stomach with before surgery, or it's like a betadine kind of. It's kind of sticky though, so it was kind of like orangish, and it was kind of sticky. So when I was washing later on in the shower, I could kind of get it off with a towel, but you had to kind of rub hard on it, and it kind of ball up and like glue. And yet I still had I had the little steri strips on the incisions. I asked him, I said, did you guys glue the incisions shut? Because I don't see any stitches. He said, no, those are all sutures on the inside. So you only see a line there, but there's no stitches to show on the outside. I thought that was kind of cool, because you're not going to end up having a bunch of lines on your stomach. And they're all very small. They're maybe 1/4 inch long at the most. I bet I probably won't even see them once they heal up. The biggest one is where the hole is from the tube that they pulled that out on Saturday, and that just has to heal on its own. They said that'll close shut. So anyway, I did take a video of the rash. It is kind of raised and hot. It's been growing from each incision site, so they have gotten bigger. They started out just around the incision, and they've just gotten more bigger raspberry as they've went. Kind of leathery looking. The one where they pulled the stomach out of is kind of bruised, but yet that's the biggest one. And the camera was by my belly button, so that one's kind of red as well, and that's been kind of growing. When I first came home, I only had one small area that was red like that on one of the incisions, and I had a kind of sporadic red rash on my right side, and was going down more toward my leg and in inner part of my leg there by the fold of the skin. So they gave me a cream to put on there, and it's a little bit better than hydrocortisone cream. Said it should work to do it. Put a thin amount on it 2-3 times a day. They said wash it off in between times, and then just reapply it after it's dried up. Reapply it, and hopefully that'll take it away. But it's hard to say at this point, so I will add that to the end of this video. I don't talk in that one, but it just kind of shows what my stomach looks like. Now, it's not the best looking, but just remember, everything's worth it in the end. I've already lost almost 30 pounds. I am happy as can be. It's been hard work. It's going to be hard work. I can resume my liquid diet now and go back to having some soup and stuff like that, and making sure I get my 64 ounces a day in liquids and my 60 ounces of protein. And he said just drink out of my stuff and be, small sips, and you'll know when you overdo it. Don't do that again. You're going to feel it. You're going to be too much, and you'll know. So I'm kind of at my own on that, just working my way up to improving the input of liquids. And anyway, you all take care, and we'll talk soon. Bye. Hey everyone, just real quick, I realized I did not discuss that now that I'm back into the liquid soups and stuff like that, I have to strain out any kind of meats or chunks out of that soup. So I did buy a strainer to do that, but our doctor's office also has many products that we can buy, soups and things like that, and then it goes by the phases of where you're at in the bariatric weight loss. the fusion vitamins, the more I find out about it, it doesn't sound like I have to take a B12 injection or vitamin separate from these. I just take 2 in the morning, 2 at night. And from what I understand, that you all might be able to order them online. I would just go to their site. It's Brian Gluck, Life Without Limits, and that's in Muskegon, Michigan. They should have their website. I've brought up his website easy by punching his name in Life Without Limits. So if you're interested in looking at the what the vitamins have in them, it's got tons of everything we need. And it sounds like all I need to do is take 4 a day and I'm good. So whether that changes down the road because of my blood changing or things that I need for me, that may change, but it's worth checking into. It's only $24 a month, and to me it's worth it. But if you're not interested in looking in the video that's at the end, you can just shut it off right now. Some people don't like to look at things that are kind of awkward or kind of grosses them out or whatever, but it is just skin, and it's a little rash. It's nothing to be concerned with. I am not hurt in any way. It's a little itchy. It's a little red. It feels a little warm, but it's not infection. It's just something I'm dealing with post-surgery here, or whatever, however you say that, after surgery. And it'll be cleared up in no time. I'm pretty fair skinned, so things like a harsh laundry soap for me could give me a rash. So could have been something as simple as whatever the binder was washed in prior to them putting it on me. I'm not even sure. So it'd be nice to find out what it is so that I can stay away from it in the end. But, you know, it's not going to ever be that easy, of course. So anyway, if you want, just shut her off and you can skip the last part. Thanks. Bye.